The purpose of this video is to provide information about why SmartWire breakage happens and ways that we can prevent it. The SmartWire is the most advanced orthodontic arch wire. It is pre-programmed, customized, multi-loop NiTi arch wire derived from the doctor's approved INBRACE virtual setup that move teeth efficiently and friction-free. However, it requires proper care and might break like any other orthodontic arch wire. As you see here, the SmartWire is broken. The question is, how did this wire break and how can we prevent it in the future? The answer is most likely the patient has broken the wire, and unfortunately, we are allowing this to happen. So let's look into the most common reasons that breakage can occur. Poor diet or unusual tongue habits, mishandling of the SmartWire, and most importantly, occlusal interference. This is the primary reason that a SmartWire can break. How can we prevent SmartWire breakage from happening? We can educate our patients on diet restrictions and inform them to avoid unusual tongue habits. We can be sure to handle the SmartWires with care. And most importantly, we need to eliminate occlusal interference on brackets or wires. Patients should avoid hard, sticky, chewy foods, such as nuts, hard candy, and popcorn. Educate patients not to play with the wires or loops with their tongue, and not to use foreign objects when trying to dislodge food. The best remedy for this would be to use a water pick. Another way to prevent breakage is to handle the SmartWires properly. Hold SmartWires with a gentle grasp, avoid distorting the SmartWires, and avoid twisting or overstretching the SmartWires. In this video, you can see the proper way to handle and insert the SmartWire with minimal distortion. Gripping the SmartWire with excessive force can damage the SmartWire and eventually result in breakage. Here, you can see that the SmartWire is being inserted with excessive distortion. Whenever possible, this needs to be avoided. Although the SmartWires are resilient, they are not indestructible. Therefore, overworking the wire can also cause breakage. Do not play with the SmartWire for patient demonstration. You have learned how to educate patients and proper handling of the SmartWire. Now let's learn about the primary cause of wire breakage, occlusal interference. Most orthodontists most commonly work with fixed labial appliances and may overlook the lingual aspect of occlusion. So they are working with the labial mode on. The key is to turn the labial mode off and turn the lingual mode on. At every INBRACE appointment, we need to check for lingual occlusal interferences of the SmartWire and brackets. As a routine, ask the patient for occlusal interference on the maxillary SmartWire. This is the main cause of breakage. To prevent SmartWire breakage, you need to learn how to check for occlusal interference and when to use temporary bite turbos. How do we check for occlusal interference? The best approach for this is to ask the patient if he or she is biting on the SmartWires. They will be able to feel the wire flexing as they bite down. In the anterior region, the interference may be visible. And lastly, you can use an intraoral scan to confirm the location where the contact is happening. In the anterior region, where visual access is better, it is usually possible to see the occlusal interference. In this case, the lower left 2 is biting on the upper left 2 bracket and can cause SmartWire damage. The intraoral scan is a good tool to evaluate occlusal interference on the brackets and SmartWire. Here we can see interference of the lower right 3 and the upper right 2. Temporary bite turbos are exactly that, temporary. Please keep in mind that these are placed as a temporary solution to disocclude the bite and should be reduced as needed. The location of the bite turbos is determined by the doctor's preference. Please also note that bite turbos can have unwanted side effects. Among these can be intrusion of the teeth that are bonded, and another would be mandibular shift. Materials that can be used for this are band cements, acrylic gels, flowable adhesives, and composite resins. Here is an example where ultra band lock is being used on the upper 5s to open the bite to avoid wire collision. If the collision is in the anterior region, we can place anterior bite turbos. One option is to use Fermit. This is a flexible composite that can be used to cover the wire, the bracket, and the lingual surface of the tooth. To use Fermit, etch the lingual surface, apply a Sure Plus primer, dispense the amount of Fermit needed, roll it into a ball, and light cure for 1 second prior to placement. This will slightly harden the Fermit, preventing it from flowing inside the bracket. Then apply the Fermit with a micro brush and shape as desired. Light cure for 5 seconds.